Hello, ladies. If you're a woman of a certain age, there is a good chance someone, a doctor, a friend, or the internet, has said something that made you scared of hormone therapy. Maybe you heard it causes cancer. Maybe your doctor just waved it off without explanation. Maybe you've just been suffering through symptoms, wondering if there's another way. Today, we're digging into the evidence, not the fear, not the headlines, the actual science behind hormone replacement therapy, what it can and can't do for weight, and why the conversation is finally starting to change. So, hormone replacement therapy replaces the hormones your body used to produce. The main players are estrogen and progesterone. And by the way, if a woman has a uterus and is on estrogen therapy, it is mandatory that she receive progesterone for protection of the uterine lining. Some formulations also include testosterone. It comes in patches, gels, pills, sprays, creams, and vaginal formulations too. And the type, dose, and delivery matter a great deal, which is why one size fits all conversation about HRT misses the big picture. Now let's address the elephant in the room. The Women's Health Initiative study from 2002. This was a large clinical trial that was stopped early because it found a slight increased risk of breast cancer in women taking the combined estrogen progestogen therapy. The headlines were terrifying. HRT prescriptions dropped by half almost overnight. But this is what the headlines missed. The women in the study were on average 63 years or older, more than a decade post-menopause. The formulation used was oral conjugated equine estrogen plus synthetic progestin, and the absolute risk increase was small, from 30 to 38 cases per 10,000 women per year. The North American Menopause Society's 2022 position statement now affirms that for healthy women under 60 or within 10 years of menopause, the benefits of hormone therapy outweigh the risks for many women. Does HRT cause weight loss? Here's the nuanced answer. It doesn't directly cause weight loss in most women. What it does is help prevent the metabolic changes that drive the menopause-related weight gain. Estrogen therapy has been shown to reduce fat deposition in the abdomen, to improve insulin sensitivity, and it helps preserve lean muscle mass. Women on HRT tend to have a more favorable body composition, less visceral fat than women who are not on HRT. And there's more. Women on HRT tend to sleep better, and we covered in episode 1 why sleep is metabolic medicine. They also report fewer of the fatigue and mood symptoms that often lead to less activity and more comfort eating. Here's one of the most exciting recent findings, and it speaks directly to what we're going to cover in episode 3. A 2024 study published in the journal Menopause looked at postmenopausal women on semaglutide, which is the active ingredient in Ozempic and Wegovy, and what they found was compelling. Women who were also on HRT lost significantly more weight than those who were only on semaglutide. At every checkpoint, 3, 6, 9, 12 months, the HRT group had a higher percentage of total body weight loss and were more likely to hit clinically meaningful milestones like 5% or 10% total weight reduction. Both groups improved metabolic health, but the combination did more. One hormone that rarely gets discussed in the context of women's health is testosterone. Women produce testosterone in their ovaries and adrenal glands, and levels decline during the menopausal transition. Low testosterone in women is linked to decreased muscle mass, fatigue, low libido, and difficulty with weight management. Testosterone therapy for women is appropriate in certain doses, which are much lower than what men use. And that's gaining traction in menopause medicine. It's not FDA approved in the United States yet, but it is used off label and it is standard of care in countries like the UK. Talk to a menopause-informed clinician about whether it might be relevant for you. Not everyone is a candidate for hormone therapy, and that's important to say clearly. Women with a personal history of hormone receptor-positive breast cancer, certain clotting disorders, unexplained bleeding, or active liver disease typically should not use systemic HRT. But for some women, especially those who are starting in perimenopause or within the first 10 years of menopause, the risk profile is favorable. The key is working with a clinician who is actually trained in menopause medicine, because general practitioners often have outdated or fear-based information about HRT that doesn't reflect current evidence. To sum it up, hormone therapy isn't a weight loss drug, but it's a powerful tool for addressing the underlying hormonal shifts that make weight gain almost inevitable during menopause. For many women, it's also a quality of life tool that makes everything else, sleep, mood, exercise, more possible. In the next episode, we are going to go deep on GLP-1 and GLP-1 GIP medications, what they are, how they work, the side effects you should know about, and the remarkable benefits beyond weight loss that are changing how researchers think about these drugs entirely. Don't miss it.